The treatment of RLS should be started with two elementary measures. One of them is conservative treatment. That's the first thing. It might not be sufficient, I know, but that should be the first step. And the conservative treatment will usually involve increasing movement, increasing physical activity, in fact, and eliminating exacerbating factors like antihistamines and antidepressants whenever possible. In addition to that, the iron status should be checked. By iron status, I mean serum iron status. And if low or marginally high, it should be increased. As a way of increasing the iron status, what we normally do is we administer either oral iron. In my experience, that works, but it works too slow, or intravenous iron. And that will improve the brain iron status, which is the one that really matters for this purpose. And in the meantime, in many situations, you might have to start a pharmacological treatment. That pharmacological treatment in patients suffering from, for example, anxiety, depression, should be performed whenever possible with alpha-2 delta ligands. In fact, antidepressants, with the exception of bupropion, should be avoided altogether. And dopamine agonists should be also avoided, if possible. For the elderly patients, the problem is that the alpha-2 delta ligands might result into an increased number of falls, coordination impairment, etc., etc. And there, these type of drugs should be used with prevention. Probably in the elderly, the decision should be made on whether to start them right away with a low dose of a dopaminergic agent. Because the lifespan is, on the one hand, it's shorter, and also these drugs are cleaner in the sense of having less toxicity, less side effects.